Hello, welcome to Making an Effective Referral. In this video, you'll see a conversation between a school staff person and a student. The school staff will be showcasing the key steps involved in making an effective health services referral. Before we get started, let's review a few referral system basics. Referrals can increase adolescent access to health services. Use of health services can improve young people's health and contribute to increased educational attainment through improved attendance and graduation rates and decreased dropout rates. The term referral is used to describe a process of assisting students in obtaining preventive health services through a variety of activities, including but not limited to connecting students to adolescent-friendly providers and support services. There are two types of referrals, passive and active. Passive referrals can be made through making referral guides available to students and including information on referral resources in health education lessons. Active referrals are made through a one-on-one conversation between a designated referral staff and a student. The staff provide information about on- or off-site healthcare providers that results in a referral. In the video, you'll see an active referral demonstrated. Designated referral staff are school personnel charged with recognizing adolescents in need of health services and referring them to care. Referral Guide is a resource that lists health service provider organizations and their relevant information. Referral guides can be available electronically through mobile apps, websites, and databases, or in a hard copy through posters and palm cards. Written procedures provide a roadmap for staff to follow when making referrals. They should outline the processes that referral staff will use to refer students to health services and should clearly define the who, when, what, and how of making a referral. The video you're about to see consists of scripted scenes that show conversations between a student and a designated referral staff person. This referral staff person has received training in the following areas: the 6 key steps associated with providing a referral, state and local policy on minors' access to health services, and use of the referral guide. She also participated in a lunch and learn with a local healthcare provider that included a review of data on adolescent health outcomes in her community. All designated referral staff should receive training to ensure they're equipped with the knowledge, skills, and resources necessary to make appropriate referrals. Now, let's see what a referral-making conversation can look like.
Miss Willis?
Hi, Crystal.
Hi.
Come in. Have a seat. How was your basketball game yesterday?
We won.
Good for you. You have an amazing team.
It was a fun game, but I messed up on my math quiz the next day, so I need to do some extra credit for Mr. Gregory.
Okay, well, it sounds like you know what you need to do and you're getting it done, right? So, what can I do for you today?
Well, during the assembly, I heard that I could get some information from you. I wasn't sure if I could ask you a personal question.
Of course, you came to the right place. And I want you to know everything you say in here is confidential, which means it's between you and I. I won't share it with anyone unless it's something that places you in danger of hurting yourself or someone else. Then I'm legally required to report it, okay? But otherwise, it stays here between you and I.
Okay, thanks. It's just that I'm scared. I don't know where to go and I'm not sure what to do about it.
Well, what's going on?
Okay, I'm freaking out. I'm worried I might have HIV or another STD. There's this guy that I've been talking to, and well, we had sex about a month ago, and we didn't use a condom. I was talking to a friend, and she said that I should get tested.
Okay, sounds like you're concerned. I can give you information on health centers in the community where you can get tested for HIV and other STDs. All you need to do is you go in there, they prick your finger, and you pee in a cup. It's pretty simple.
Oh, that doesn't sound too bad. I've heard that there are places to go for HIV and STD testing. I didn't know where to go, and I don't know anything about how much they cost.
Well, a lot of students I talk to don't know where to go for health services. I can give you information on some health centers in the community that provide no-cost or low-cost services for teens. I've even visited them to make sure that they can help you.
I'm just nervous about what it's going to be like. I've never gone to the doctor by myself before.
Well, it's normal to be nervous about your first visit. The staff at these healthcare centers are professionals. They provide HIV and STD testing and services for teens all the time. I have a list of health centers in the community that provide health services for teens. What I'd like to do is take a look at that guide with you and see which ones fit your needs. Is that okay?
You know, I've heard that the teen health center downtown is okay. I don't know much about it.
Well, it's on the list. It is close to the school and it's on the bus line. So are you comfortable with going to the center that's near the school, or would you like to go somewhere else?
I need somewhere close because I wouldn't know how to get there otherwise.
Okay, so this is a good option. They provide HIV testing, they provide STD testing and treatment. They also provide information on birth control contraception and pregnancy testing. And I see here that they have a same-day walk-in appointment. So, do you have an idea when you would like to go?
I mean, I really want to get this over with, so the sooner the better.
So we have several options. We can call right now, or you can go online, you can call them yourself, or you can do a walk-in. Would you like us to call right now as long as you're here in my office?
I think I'll just take the information and call later today to make the appointment.
That's great. That's great. Do you have someone that can support you? Maybe even go with you, like a close friend or a family member?
I think I could ask my older sister. I bet she could go with me. It would make things a lot easier. So, what should I tell them when I call?
That's a great question. So when you call them, you want to let them know that you want to get tested for HIV and STD. You also want to let them know what's the best time for you to go, right? What day and the time. And you want to ask them if you need to bring a photo ID, like a school ID.
Got it. Okay. So, what about the visit? Like, what is that like?
So when you arrive to the health center, you go to the front desk and you'll sign in. You want to make sure you get there about 15 minutes before your appointment so that you have time enough to fill out the paperwork.
Okay.
Then a staff member will come, get you from the waiting room, and they'll ask you questions. They'll ask you why you're there. You want to make sure you tell them all of your concerns so that you make sure you get the services you need that day. Afterwards, a clinician will see you and they'll provide you with testing and information that you need.
That doesn't sound too bad. I think I can do that.
I know you can do that. So, I'm going to circle the health center you selected so you have everything that you need. And Crystal, I want you to know that I am here for you if you have any questions or concerns. Would it be okay with you if we talk after your appointment, just to see how everything went for you?
Sure. I will let you know how it goes.
Okay. All right. So I'll see you next week, okay?
See you next week.
All right.
Hi, Miss Willis.
Crystal, hi. How you doing?
Good.
It's nice to see you again. So, how did the visit to the health center go?
It was fine. I wasn't sure how it was going to be, but they were really nice. They asked me a lot of questions, and it wasn't too bad. I tested negative for HIV and STDs, and we also talked about how to protect myself by using condoms, and they gave me birth control so I don't have to worry about getting pregnant.
That's great. You took a big step. And it seems now you have a health center you can go to for your regular care. And you can always come back and talk to me anytime.
Thank you for your help.
Oh, you're welcome. You're welcome. Now talk to me about Mr. Gregory's class.
Oh my gosh.
Work assignment.
That extra credit was totally easy. I don't even know why I was worrying about it.
As you saw from the interaction, Ms. Willis was able to use the 6 key steps for making an effective referral to guide her conversation with Crystal. These are build rapport, ensure confidentiality and consent, identify student needs, select the appropriate service provider, make and recording the referral, and follow up after the referral. When building rapport and connecting with the student, it's essential to use key communication skills. During the video, Ms. Willis used open-ended questions, affirmed Crystal for taking care of her health, normalized her experiences, reflected Crystal's thoughts and feelings, and summarized key points with her conversation. These skills helped create an environment of trust and comfort to ultimately help facilitate Crystal's access to health services. The referral system information provided in this video was based on an implementation toolkit developed by CAI, the National Coalition of STD Directors, and CDC Division of Adolescent and School Health. To download a free copy of the kit, visit our website, connectionsforstudentsuccess.org. By making referrals, you're supporting the health and academic achievement of our youth. As trusted adults, you have the opportunity to have a positive impact on the lives of your students.